Hello, it's Dr. Joseph Walrath again. I'm moving right along in my series of oculoplastic surgical teaching videos. And today I'm going to talk about brow lift and upper blepharoplasty. This video accompanies another basic video which kind of breaks down the different classes of droopy eyelids and some of the sort of general topics in upper eyelid and brow surgery. And this is a little more specific and has some of the details that are specific with lots of before and after pictures to view. Once again, it's Joseph Walrath. I'm an oculoplastic surgeon. I'm a specialist in eyelids. I don't do butt lifts. I don't do breast lifts. I don't do face lifts. I do literally 1,000 eyelid oculoplastic cases a year. I'm going to talk first about upper blepharoplasty, which pretty much means remove or rearrange the tissue under the brow, between the brow and the lashes, the puffy tissue, the baggy tissue of the upper eyelid. I'm going to talk about removing and repositioning skin, muscle, and fat. I'm going to talk about the level of anesthesia that goes with this case in general. Most of the time, it can be done completely awake. It takes 30 or 40 minutes, and a lot of times it's covered by insurance, depending on the level of the skin blocking the visual axis. And I'll show plenty of examples of these. This is half of blepharoplasty on the left side of the screen. It's been done. On the right side of the screen, it has not yet been done, but it's been marked. All that tissue on the right side of the screen is about to be removed, and it hangs down like curtains over the eye. I'm going to trim those curtains, and that's what happened on the left side of the screen with a neat incision right in the lid crease there. Notice that the upper eyelid closes after surgery. That should be your expectation after upper blepharoplasty. I'm going to show you some before and after photos, which is really the best way to illustrate these topics. Every patient that I show in my videos was operated on by me, and every patient gave their consent to have limited photos of their eyelids shared. This is a gentleman who elected to have a cosmetic surgery of the upper eyelid, a cosmetic blepharoplasty to remove the skin folds above the lashes. Now, as an aside, he also wanted to have some puffiness from the lower lids removed as well. And here's his after photo. You see that right and left look the same. He's recognizable as himself, but just looks a little more youthful. The incisions of the upper lid have healed quite nicely. This is him 2 months after surgery. With the eyes closed, you can see the incision, and they really go away. This is another patient before cosmetic upper blepharoplasty, and this is after surgery. You can see the puffy tissue is now been removed, and you see more of the upper eyelid where the eyeshadow goes. This was a cosmetic procedure because the tissue was not low enough to block her vision. This is a medical condition. You notice that the lid tissue is actually getting into the pupil. Now, this patient also has a separate disorder called ptosis, where in addition to the extra skin, the lid itself, where the lid margin is and the lashes come off, is also low, and that had to be lifted as well. This is 2 months after upper blepharoplasty with Asian lid crease fixation and ptosis repair to balance the lid heights out and to improve her vision, but also to have a significant cosmetic benefit as well. This is a young Vietnamese woman with some obscuration of the lid margin. She wanted a double eyelid, and basically what that means is remove some of this extra tissue, create a nice lid crease so that she looks a little more inviting, maybe a little less severe, as to have that heaviness obscure the lashes. This is about a month after surgery. This is a medical case. You can tell the tissue getting down into the pupil, obscuring her visual axis. This patient elected to have lower blepharoplasty, which was cosmetic at the same time. Insurance paid for her upper eyelids. She paid for her lower eyelids. This is 2 months after surgery. She's healed quite nicely. You see it's very difficult to spot the incisions at this point. And after a couple more months, you won't see any incisions like that. This is a gentleman here who had upper lid tissue blocking his vision as well. Now he said, you know what, I really want to fix my lower lids, get rid of some of that bagginess, tighten them up a little bit. And I said, you know what, we should also get rid of that angry brow configuration, because he wasn't feeling angry. That wasn't the emotion he was trying to convey, but nonetheless, when the brows are angled like that, it makes people think you're angry. This is after surgery. Repositioning the inner brow, cosmetic. Fixing the lower lids, cosmetic. But removing the tissue from the upper lids was medical, and insurance paid for that portion of his procedure. This is a very similar upper lid and brow case. Upper lid tissue blocking his vision, but the brow made him look angry, despite the fact that he really wasn't angry. This after surgery. Upper blepharoplasty and inner brow repositioning. This is an Asian patient with some imbalance in the lid height and imbalance in the lid fold. There was internal ptosis repair performed on the right side to balance the lid heights, and there was Asian blepharoplasty on each side. This was a cosmetic procedure. This is after surgery. And again, like all good eyelid surgeries, at the end of the day, right looks like left. This is another cosmetic case. She wanted to look a little more youthful, see more of her eyelid. And I said, you know what? Your eyes are a little droopy too in terms of ptosis. It's not just extra skin, but we have to open up your lid margin, open the window a little bit too, and you'll look a lot brighter. And this is her after surgery, removing some tissue, but also brightening her up by treating the ptosis. If your procedure is medical, we can do an office or telemedicine consultation. Now, if you have commercial insurance, there's always a need for visual field testing, and that's an in-office test, which takes about 5 minutes. My office is really good at working out the details with insurance, so we will get prior authorization if that's required. Medical clearance may or may not be required depending on your medical history. If your procedure is cosmetic, we can also do an office or video telemedicine consultation. Our surgical planning and fee quote will be delivered to you either in person or electronically. Typically for upper blepharoplasty, the professional fee is between $3,000 and $5,000 and usually on the low end of that. There's a facility expense depending on where you have the procedure, and there's interest-free financing available. Many patients are going to have simple upper eyelid or brow procedure that's cosmetic, elect to do it in the office treatment room because it's just cheaper and it's not a bad experience. You don't need an anesthesiologist for that. It just saves money. As I said, upper lid surgery is not difficult on the patients. They generally have a good experience. This guy had such a good time he wanted a group photo. After surgery, the recovery period is really not that difficult. First 3 days, rest, ice, comfy chair, take some Tylenol, take some Motrin. I really don't prescribe narcotics for this kind of pain. Light normal activity for the first 2 weeks after that. Stay in a clean environment, keep the contact lenses out. If you're going to do really stressful exercise or put on swim goggles, do powerlifting, do intense yoga, give it 3 weeks before you start doing that stuff again. Our post-operative visits will be at a week or 2. They can be in office or telemedicine with the option to convert to an in-office, in-person visit if there's a concern. There's an optional post-operative visit at 2 to 3 months. This could also be office or telemedicine. These sutures that I use are typically dissolvable. This is a typical post-operative week. Smiley faces every day, not that painful. By day 8, a little bruising in the cheeks following gravity, but after that, generally uneventful. This is an example of some of the long-term healing from upper blepharoplasty incisions. These are actually at 2 months. I do this incision 1,000 times a year, and I revise it once or twice a year. This is a very good incision. It goes away, and your expectation should be that these incisions are going to be invisible at the end of the day. And the end of the day comes in a couple of months, but patients aren't really bothered with the incisions during the healing process because when the eyes are open, the incisions are tucked into the lid crease. What's the risk of upper eyelid surgery, specifically upper blepharoplasty? Reoperation, generally speaking, that means, hey, doc, remove a little extra skin here. No problem, do it in the office. Infection, I don't believe in 12 years I've ever seen an infection from upper blepharoplasty. And largely because the upper eyelids have such a good blood supply that you really don't see infection there. Now, you could have excessive bleeding in the upper eyelids. That can cause delayed healing. That's a risk. That risk is perhaps once or twice a year. You can have worsening dry eye. That's really rare. And in general, if you have worsening dry eye after upper blepharoplasty, you're sent to me to fix it. I don't cause that problem. It may also not meet your expectations. I try really hard to communicate with patients so that we're all on the same page so that we can have a really good outcome. Moving along to the brow lift now. This is the raising the curtain part of the story. We trimmed the curtains by removing some skin beneath the brow. That was a blepharoplasty. Now we're going to lift the brow. This is raising the curtain rod. Now there's different ways to raise the curtain rod. Full disclosure, the only way I do it is direct brow lift. There are advantages and disadvantages to each of the procedures. I'm going to discuss them. An endoscopic brow lift is a common cosmetic brow lift. There are small incisions made in the scalp and behind the hairline, and through those small incisions, the entire scalp and forehead is freed up with these special instruments that free the whole thing up, and then you stretch that forehead and you anchor it with a couple of anchors in some of those small incisions behind the hairline. What are the advantages? Small incisions. I think that's really the only advantage. What are the disadvantages? Oftentimes it doesn't do a whole heck of a lot for severe droop. I don't think it's a good choice for severe droop. One of the big problems with endoscopic brow lift is it can cause hairline recession because, as I said, you free up the scalp, you free up the brow, you stretch the scalp and forehead and anchor it, elevate it, and that can cause your hairline to go back or make your forehead look elongated. Your forehead could turn into a 5-head. And so in general, that's not a very youthful look. Some patients are at risk for that. It can cause hair loss around the incisions. That's really unusual. Persistent swelling, also unusual, can be a real pain in the butt. It generally requires general anesthesia and a surgical setup that's a little bit more involved than other types of brow lifts. This sort of procedure is never covered by insurance. A coronal brow lift is another cosmetic brow lift, and in general, this procedure involves an incision from ear to ear, either in front of the hairline or behind the hairline. Now, one advantage is it can lower your hairline if you do it in front of the hairline, and it's really effective. What are the disadvantages? You have a large incision in front of the hairline, which takes time to heal, but can heal nicely. You'll get numbness above the incision all the way back along the scalp. It requires general anesthesia. It's also never covered by insurance. Those last two procedures I don't do, and if that's the right procedure for you, I'll send you to somebody good during our consultation for that procedure. I do direct brow lifts. Now, direct brow lift involves an incision directly above the eyebrows. I'll show you plenty of pictures of this. What are the advantages of that? It is the most effective brow lift. It has the best control of brow contour. It will not cause hairline recession. It might be covered by insurance. It could be done in the office without general anesthesia. It maybe takes 30-40 minutes. What's the disadvantage? The disadvantage is it puts an incision above your brow, which takes time to heal, and in some cases requires scar camouflage or microblading the brow or other techniques to hide an incision. Usually it heals as a fine wrinkle. This is an example of a lady having a direct brow lift in the operating room. Well, she's actually had half of the direct brow lift. The left side of the screen shows the brow, which has already been lifted with an incision right above the brow. It's been closed with those little blue sutures. The other side of the screen shows the marking and has not yet been performed. As I said before, direct brow lift offers really excellent control of brow contour. If you look at this gentleman, you can see that on the left side of the screen, the inner part of that brow goes way down compared to the other side. And I mark these patients preoperatively, adjust the brow with my fingers, and figure out how much surgery I need to do to get the contours to match. This is a young woman on the table with brow asymmetry, and she was unhappy and had prior brow procedures before that did not address it adequately. And you can see that I've designed my incisions to correct for the asymmetry of her brow position. I'm going to show you some photos of direct brow lifts before and after surgery. All these patients are my patients. They've all given their consent to have their photos presented. This is a lady with a medical condition. Her brows were low enough to cause the tissue to hang down and obscure the vision. And this is from the side. You can see that the brow tails off. And this is 2 months after surgery. You can see the incision is still faintly visible as a red line, but you can see the whole row of eyelashes in some of the upper eyelid now. I'll go back to the before photo, and you see it on the side, folding down into the vision. You can't really see much of her eye. Now you see a lot more of her eye. Her vision's a lot better, and she looks a lot more youthful and is pretty happy as well. This was covered by insurance. Now, this is a woman who came to me who was very unhappy after having cosmetic surgery elsewhere. She had some upper eyelid surgery. She had some lower eyelid surgery. But the thing that really bothered her was the brow lift. She had an endoscopic brow lift, and she wasn't happy with the shape. This is 1 month after direct brow lift revision. And I talked with her about these incisions. I said, look, you're going to have incisions. You're going to have to do something about them. This is 2 months later after direct brow lift. She's quite happy. As you can tell from the side view, this was before the direct brow lift to contour. And this is after a nice arching incision laterally. She's really quite happy and comes back every couple of months for Botox. This is a gentleman here before upper blepharoplasty, but I said, hey, you really should lose the ticked off look. These eyebrows angling inward make people look angry even when they're not. So the upper blepharoplasty was covered by insurance. It was blocking his vision, but he elected to have a cosmetic brow reshaping. And now his brows have been lifted on the inner corner, and he looks a lot more inviting, a lot more neutral in his emotional state. And this is a very similar case as well. This guy had some extra tissue in the vision. His insurance paid for upper blepharoplasty, but I said we really should get rid of the angry brow look. And this is after surgery. And again, he looks a lot more neutral and a lot more inviting than before surgery. So if your procedure is medical, you get this office consultation. Could be a telemedicine consultation. If you have commercial insurance, you probably need to do a vision field test. We'll take care of all of that. My office will obtain prior authorization if it's required. If you have a medical reason, for example, taking a blood thinner that requires your internist to weigh in, we will coordinate that. If your procedure is cosmetic, you'll get a fee quote in the surgical planning. The professional fee is listed between $2,500 and $4,000 for the professional component, some variable facility fees depending on where you choose to have the surgery. We have care credit interest-free financing. If you're going to have an isolated cosmetic brow lift, I'm going to encourage you to do it in the office because it's just cheaper and it's a pretty good experience. After surgery, for the first 3 days, rest, ice, comfy chair. Same as for upper blepharoplasty, basically. You can see a full list of my postoperative instructions on the website. What are the risks of direct brow surgery? You can have numbness in your forehead. That's really unusual and typically transient. You can have forehead weakness. I've never seen that with direct brow lift. I've seen that with endoscopic brow lift, however. And the big risk is prominent incisional scar, which could require scar camouflage. Once again, this has been Dr. Joseph Walrath. I hope this presentation has been enjoyable. It's helped you understand upper blepharoplasty and brow lifting. So whether your problem is medical or cosmetic, we're looking forward to helping you reach your best outcome, and I look forward to seeing you soon.